This is an ABC News special report.
Hello, everyone. I'm Kenneth Moten. We are interrupting our normal programming to bring you the breaking news that President Trump and the First Lady have tested positive for the coronavirus. Again, President Trump and First Lady Melania Trump have tested positive for COVID-19. The president tweeted this just moments ago, this statement here that we understand the president was saying and confirming the news that he tested positive. This comes just hours after we learned that one of the president's closest advisors, Hope Hicks, tested positive for the virus. She tested positive on Wednesday night and had been experiencing symptoms. She had been traveling with the president for on several trips this week. We understand the president also did a phone interview with Fox News' Sean Hannity earlier overnight, confirming that he took a test. The First Lady also took a test. But again, President Trump has tested positive for COVID-19. He tweeted out that tweet earlier tonight. We are waiting to hear more from the White House on the president's condition. We're also waiting to find out if the president is experiencing any symptoms as well as the First Lady. Right now, we are getting word now that we have somebody on standby. Who is it again? It is Dr. Jen Ashton. Dr. Ashton, thank you for joining us for this breaking news right now that we are interrupting programming for. At this point, we're still trying to learn more about the president's condition and this positive coronavirus test. What can you tell us?
Well, you know, last night when it was announced that Hope Hicks had tested positive for coronavirus, and of course she had been traveling with the president and in close, prolonged contact, this was not a surprise that the president would be tested and anyone else who had had prolonged close contact with his aide. We have to remember, based on a study just released out of India, the chances of becoming infected after prolonged close contact ranged anywhere from just over 4% to just over 10%. And of course, we know that in the past, the president has been sporadic at best with mask wearing. So again, for anyone in the medical community, this was probably not a big surprise.
When you see and hear the reports of the fact that we know that his closest advisor, Hope Hicks, was in close proximity, she was on Air Force One traveling to and from the presidential debate earlier this week. We understand she was on another trip with the president. This really shouldn't come as a surprise because she was also on Marine One with the president in very close proximity.
Right. And, there's so much we don't know about SARS-CoV-2, but from the beginning, the recommendations from the CDC was that anyone within 6 feet of distance for more than 15 minutes of time exposure to a known positive case was considered at risk. And certainly without one or both people wearing masks, we don't know if that was the case with Hope Hicks and the president. But, this is a virus that has shown that it is readily transmissible. And, we haven't known a lot during the course of this pandemic because it is so new, but prolonged close contact has been known since the beginning. So, this is just a demonstration that, in fact, no one is immune from becoming infected with SARS-CoV-2.
All right, Dr. Jennifer Ashton there, please stay with us. I want to bring in my colleague, Mona Kosar Abdi, as well. And Mona, to read that tweet one more time from the president, he said, "Tonight, Flotus and I tested positive for COVID-19. We will begin our quarantine and recovery process immediately. We will get through this together." We know the president is also at the White House with the First Lady. So let's bring in our chief White House correspondent, Jonathan Karl. Jonathan, what do you know?
Well, we have the statement from the White House saying that, quote, "The president and First Lady are both well at this time, and they plan to remain at home within the White House during their convalescence." A truly remarkable statement. It goes on, "The White House medical team and I will maintain a vigilant watch, and I appreciate the support provided by some of the country's greatest medical professionals and institutions. Rest assured, I expect the president to continue carrying out his duties without disruption while recovering, and I will keep you updated on future developments." That is the statement from White House Press Secretary Kayleigh McEnany for Kelly McEnany from the doctor, Dr. Sean Conley, the White House physician. I mean, this is a truly shocking development. We are a month out from the presidential campaign. I mean, from the presidential election. You have, a quarantine period would normally be 14 days. He's positive. Who knows? Certainly that would be a minimum, raising the likelihood, if not certainty, that for at least half of this campaign going forward, the president will be under quarantine. And the situation could be far beyond that as well.
And John, earlier when the president tweeted out that Hope Hicks tested positive, he said, "We will begin our quarantine process." He said it before he announced that he was testing positive. Even in this week's debate, he was essentially mocking Joe Biden, has mocked Joe Biden for how often he wears masks in public. Do you think that this will reflect negatively then on his campaign approach about saying that he was going to hold live rallies, hold rallies without social distancing, without people wearing masks? He said that he does maintain a distance, but we see now that he has tested positive. How does this change the campaign going forward?
Well, look, the president had 5 campaign events scheduled. He was supposed to be campaigning in Florida today, Friday. He was scheduled to be in Wisconsin. He had a full campaign schedule. Obviously, that all goes out the window. But you raise a really important point. The president has gone forward with, as if the pandemic was a thing of the past. In fact, he just spoke via video to New York's Al Smith dinner, talking about the pandemic as something that was very soon going to be over. This has been his theme. Those have been his words, but it's also been his actions. The president announced Amy Coney Barrett as his nominee for the Supreme Court vacancy created by the death of Ruth Bader Ginsburg at the White House over the weekend. It was an event that was held in the Rose Garden. It was a Rose Garden that was packed. People seated shoulder to shoulder, virtually nobody there wearing masks. This has been routine. This is the way. I mean, I was out at the debate in Cleveland, and you saw the president's staff. He had 20 seats set aside for family and advisors, and almost none of them were wearing masks. At one point, somebody from the Cleveland Clinic, which hosted the debate, had to come in and hand out masks to the president's family and supporters. It's almost as a badge of honor that the president and his senior staff have almost never been seen wearing masks. I mean, only a handful of times have we seen the president himself wearing a mask, let alone his top advisors. This has been. I mean, I go to the White House quite frequently. There are signs as you enter the White House complex that say maintain social distancing, 6 feet apart. You go inside that White House complex, and as a matter of course, the press maintains social distance and wears masks, but you do not see the same thing happening by and large for the senior staff in the West Wing. This is a White House that has tried to send out a message to the American public that this thing is over, meaning the pandemic is over. And now we see dramatically in this statement from the White House that is obviously not true. The president himself testing positive for this disease.
And Jonathan, we've seen other foreign leaders get this virus, recover from this virus since this pandemic started. But we haven't had the leader of the free world, the president of the United States, get this virus. What do you think that means? The world is watching right now, and the fact that the president of the United States has tested positive for COVID-19. What do you think the impact of that?
The world is watching, and the world is watching a leader who has actively downplayed the danger of this virus. A leader who has said, who has over and over again raised doubts about the need to do such basic protections as wearing a mask. deal with this virus. Interesting, you raised a really interesting point. I mean, we have seen other world leaders test positive, including two world leaders who are particularly close to Donald Trump. Boris Johnson, of course, had tested positive and recovered. Bolsonaro of Brazil tested positive and recovered. But those are two leaders, both who faced real questions about how they handled the pandemic in their countries, and who were leaders in some sense in the mold of Donald Trump get through this. So we'll see where this goes. Donald Trump's obviously, somebody in a very tough place to have this in terms of his age. He's somebody in his mid-70s. Not particularly active lifestyle. I mean, he's active out on the campaign trail, but he's somebody who, also as kind of a point of pride, doesn't really exercise. This is a perilous moment for the president and for his administration and for the country.
And Jonathan, you mentioned that the president admitted that he downplayed the virus when he knew it was highly contagious. How do you see him changing the narrative of the fact that he has now tested positive? We're just weeks before the election, and we're now seeing that the White House isn't even exempt from the coronavirus.
Well, I listened very carefully when the president went on Sean Hannity's program several hours ago, and first talked about Hope Hicks testing positive. And I could hear in his voice a fear and uneasiness. Sean Hannity waited until the very end of his interview to even bring up the fact that Hope Hicks, who is as close an advisor as the president has on the West Wing. I mean, I don't know if there is an advisor in the West Wing who spends more time with Donald Trump than Hope Hicks. And Hannity waited toward the end of the interview to ask about the big news, and you could hear. I detected fear in the president's voice. He talked about how much time he spends with Hope Hicks, about how he and the First Lady were waiting for their tests, and about how they were they may have to quarantine, that he could in fact have the disease, and Sean Hannity tried to push off, get onto other subjects, and the president kept on talking, which I saw as a sign that it really hit him, and there were fear. Now, there had been scares inside the White House already. When you think about it, back in May, the president had a situation where his valet, this is the person who serves his lunch to him at the White House, his valet tested positive. Also, his national security advisor in July tested positive. The press secretary for the vice president, Katie Miller, tested positive. So there have been, this disease has reached inside the West Wing already. But, now obviously you have a situation where it is the president's closest advisor and now the president and First Lady. So this is no longer an abstraction. This is no longer something that the president can downplay and minimize. This is the ultimate game changer in terms of how the president deals with this disease and, of course, what this campaign looks like. I mean, we're preparing for 2 more debates. Right. Talk of potential rule changes and the like after what happened in Cleveland. But obviously, you can't go forward with presidential debates while the president is dealing with coronavirus. This also raises questions about when exactly he became infected. We all watched that debate in Cleveland, where the president stood at a socially distance from Joe Biden, but he was on a stage with Joe Biden. He wasn't just talking to him; he was yelling. So I think this is a real wake-up call and a scare, not just for the president and his team, but like I said, for the country.
Jonathan, Karl, thank you so much. I appreciate it. Stand by for us. You were just referencing the president on Fox News earlier today on Sean Hannity. We want to play that moment for you. Take a listen.
I just went for a test, and we'll see what happens. I mean, who knows? But you know Hope very well. She's fantastic, and she's done a great job. But it's very, very hard when you are with people from the military or for law enforcement, and they come over to you, and they want to hug you, and they want to kiss you because we really have done a good job for them. And you get close, and things happen. I was surprised to hear with Hope, but she's a very warm person with them, and she knows there's a risk, but she's young, and I just went out for a test. They just do it. It'll come back later, I guess. And the First Lady also, because we spend a lot of time with Hope and others.
Again, that was President Trump earlier on Fox News before we believe that he learned that he tested positive for COVID-19. Let's bring in our chief global affairs correspondent, Martha Raddatz. Martha, we know that, as Jonathan just mentioned, that the president was standing socially distant away from Joe Biden, but now there is a concern about what happened in that debate hall. Should Joe Biden get tested? Your thoughts?
Well, just remember that was just days ago, and when you look at COVID testing and how it can affect people, you want to go back several days and to see who those people were around. So Donald Trump, it's now Thursday evening, Friday morning here in Washington, D.C., and that debate, of course, was Tuesday evening. So they're going to have to look at everybody, or certainly be aware that everybody could have been exposed in some way. They were in a closed area. They were socially distant. But you also have to remember what the president was talking about at that debate, too. He had a mask in his hand and almost was making fun of Joe Biden at that debate for the fact that Joe Biden wears a mask quite frequently.
And Martha, the president, while he was awaiting the results of his test after it was announced that Hope Hicks tested positive, he had a jam-packed schedule, including an intelligence briefing with some of the most senior aides at the White House. And all of that seems to be right now off his schedule. How do you see this playing out in the days that are approaching and in the weeks leading up to the election?
Well, they're certainly going to have to look at all of his national security team as well and keep an eye on them. I mean, the president does get briefed, an intelligence brief, very frequently. I believe he was supposed to have one on Friday morning as well. That will be off. They obviously can brief him. But this could very easily spread through the White House. The president meets with all kinds of people. It's not just Hope Hicks anymore. I mean, you're talking about hours later. The president also tested positive, the First Lady as well. So they're going to have to look at all of the ramifications of this, people checking classified information if they have to come into the White House. This will really reverberate through the entire White House. I mean, you can talk about Kayleigh McEnany, who was briefing today, those reporters in the room, and others she meets with. As John Carl knows better than anybody, that is a pretty small place, and there are frequently meetings throughout the day.
And Martha, we're going to get to our White House producer, Jordan Phelps. But before you go, I have to ask you this about the global scale of this. You are our chief global affairs correspondent, but you've also obviously traveled around this country talking to voters. But we're hearing from our Rebecca Jarvis that stock futures immediately sold off on the news that President Trump has tested positive for COVID-19. This is going to have a major impact globally.
It will indeed. And the world is already looking at the United States in terms of COVID-19 and the record the United States has with COVID-19. And they heard and hear constantly what the president is saying about it, and that it is not something he worries about greatly in terms of himself and others in the White House, because they're protected in some ways because they're tested all the time. And if it can hit the White House, it really, truly can hit anywhere. Other foreign leaders certainly looking towards the U.S. as well, and the reaction here.
All right, Martha Raddatz here. Thank you so much. Let's bring in Jordan Phelps, White House producer, who recently traveled with the president on Air Force One. Jordan, talk to us about the protocols that are in place when you travel, anyone who's near the president.
Yes, absolutely. So big picture, I think it's important to point out that the White House has sort of praised itself for having this bubble from the coronavirus. Every day, anyone who is going to go into contact with the president gets a test at the beginning of the day, a rapid test. That was the case for me on Wednesday morning when I was set to travel with the president and his team on Air Force One as the travel pooler for ABC News to Minnesota, where the president not only hosted one of his mega rallies at an airport hangar, but he also hosted a fundraiser. So I got that test, never got any word back, which is good news. Presumably everyone getting on that plane is COVID-free. And in fact, it's very common for most of the people on that plane not to wear a mask, except for the press corps. I arrived at Andrews Air Force Base. I saw President Trump, along with Hope Hicks, get off the presidential helicopter, walk onto the presidential plane. And, so they were on that helicopter together in those very close quarters without wearing masks, presumably. And then, we went through the motions of that day, most people not wearing masks. Remarkably, we went to one of these mega rallies, which have just been stunning events to go to amid this pandemic. It's really like stepping into an alternate reality where right now so many of us are limiting our contacts in our day-to-day lives, skipping basic trips to the grocery store, and you show up at one of these rallies with thousands of people there, the president's supporters, the president not wearing a mask, most people in those audiences, frankly, also not wearing masks. As we've been talking about, the president famously downplays the importance of wearing masks, and clearly his supporters have taken those cues from the president, even though he insists that he is in favor of masks. We talk about an October surprise. It is hard to fathom a bigger October surprise than the president actually catching the virus that he has been so defiant about and downplaying in the lead up to this election. It's just hard to understate how remarkable these rallies have been, where the president, we've asked the president repeatedly, aren't you worried for yourself? Aren't you worried for your supporters who are there to get sick? The president, the White House have always emphasized that the president is kept at some distance, that they have these intense testing regimens in place to protect the president. Of course, unsaid among all of that is the people who are there taking that risk upon themselves to be in the crowd, not socially distant. The White House has always said, look, this is an issue of freedom of speech, and they are not afraid of this virus. Clearly, this now is evidence that the White House maybe had reason to be more afraid than they have been, and the confidence that they had in that testing bubble has clearly now been shattered.
And Jordan, we just got a tweet from the First Lady Melania Trump, who says, quote, as too many Americans have done this year, POTUS and I are quarantining at home after testing positive for COVID-19. We are feeling good, and I have postponed all upcoming engagements. Please be sure you are staying safe, and we will all get through this together.
Now we're going to bring in John Santucci, who has covered the president since the launch of his campaign back in 2015. John, Jordan touched on a number of things. She touched on the fact that the president, during his rallies, he was holding rallies where there was no social distancing, where people were not wearing masks. But I actually want to go back, and when he accepted his party's nomination, he broke from tradition. He held that event on the White House grounds. The optics don't look good going forward. How do you see the president's campaign bouncing back from this?
I honestly, I couldn't even make up a good answer to try to figure this out. I have to tell you, I can't stress enough, and to your point of how long I've covered him, I have heard from so many people tonight, prior to him testing, everyone thinking he has to have it in his inner bubble. And now the fact that I can't even get folks on the phone, the amount of sheer panic that is going on within the West Wing, within the president's campaign, cannot be understated. And you have to remember, too, think about the last couple of days of Donald Trump's life. I mean, he is often attacking Joe Biden for not being out, not campaigning. Well, Donald Trump, within the last 5 days, which, as we know, is when this thing can be contagious, and then eventually you come out and have symptoms. Think about what he's done. He was on the trail yesterday, as Jordan just talked about, in Minnesota. Prior to that, he's at the debate. He is doing debate training with members of his key core staff, his personal lawyer, Rudy Giuliani, there, Chris Christie, the former governor of New Jersey, there. He had a huge event at the White House on Saturday afternoon in the Rose Garden, to your point, another big event at the White House, for his new Supreme Court nominee, Amy Coney Barrett, surrounded by his top advisors, his top folks, the folks that are out on the campaign trail, sometimes with him, sometimes without him. Remember, the president's campaign is actually campaigning. They are doing bus tours. They are doing stops at local community centers, diners. They are trying to actually move on past this pandemic that they choose to ignore. That is going to be a massive problem right now to try to figure out how they move forward. And I got to tell you something, guys. Think about this for a second. You know, hope was around the president. The president has gotten this. Questions now need to be asked about who else is probably positive at this point. You know, Jordan spoke about a little earlier the fact that Hope was on Air Force One yesterday in quarantine. There were multiple people in the president's inner circle. Forget national security. Forget, his press secretary. The list just goes on and on of individuals that travel with this president. And the other thing I would note, too, that, think about how most offices and businesses and any place of work, frankly, right now, we are all operating differently. I'm speaking to you right now from one of the rooms in our house. We're not running the cameras in the bureau or anything like that. Granted, it's late at night, but it's also that we're not operating in normal functions. The White House is. They are operating, they are gathering, they are meeting in person. Things have not changed at 1600 Pennsylvania Avenue, despite the fact they have changed everywhere else across the 50 states.
And John, a moment that stood out during the Democratic National Convention was when a woman whose father died from the coronavirus said the only pre-existing condition that her father had was trusting Donald Trump, supporting Donald Trump. He has a loyal base, but how do you see this? How do you see his base reacting to this? And will they ask, how is he able to keep the country safe if he wasn't even able to keep himself safe from this virus?
Look, that's going to be a question. I mean, look, we look at the pictures that came out from the rallies. I mean, I have the image of that rally he did in North Carolina burned in my brain simply for the fact that you had supporters on top of each other as he spoke to a large crowd outside an airport hangar, most of them not wearing a mask. I think that's going to raise a lot of questions now. If he can get it, who cannot get it? I mean, I think that's the way people do look at this president in some ways. Well, he's doing fine. He's healthy. He's out and about. He's traveling. Maybe this thing isn't real. I do think that is going to be a real issue right now for this president. Now, look, if it impacts votes, I think that's going to be something we're really going to have to look at, as we know from all of our polling and as our colleagues have been able to travel the country and speak to his supporters. A Trump supporter is more often than not usually a diehard supporter. And we know most people going into this election have pretty much made up their minds. But this is certainly going to be something that is going to give people pause. I know Rebecca Jarvis is already reporting that stock futures have been affected on this. We know the president raves and cheers on the stock market at every chance he gets. The morning hours are going to be quite interesting to what the world looks like when we all wake up. I don't think we're going to bed tonight, but we'll see what happens.
We are definitely not going to bed tonight because, again, this is this breaking news that is out. John Santucci, thank you so much. Again, President Trump has tested positive for COVID-19. Outstanding questions here because we are in uncharted territory. The questions, Trump's condition at this point, even though the First Lady did tweet out that they are feeling good. Another question, any impact to Vice President Mike Pence? Has he been tested? Who else in the president's inner circle has been impacted? Also, what happens to the remaining debates? Let's bring in senior White House correspondent Cecilia Vega right now. Cecilia, is it surprising to you? Because, yes, we know this president and he has kind of flouted this whole thing about not wearing masks, going to these rallies. Are we surprised by this diagnosis here?
I mean, it's shocking given where we are this close to an election. In one hand, it's not shocking after the news of Hope Hicks testing positive because she is among his closest aides. They were right next to each other on that small space Marine One, the presidential helicopter. She is in the Oval Office all the time in direct contact with him. So just in terms of the logic of the way COVID spreads, it's not surprising that he caught it then. I mean, you listed those questions, Kenneth, coming into me right now. I think a huge question right now also has to do with Joe Biden. Has he been tested? Will he get tested? Will they give us the results of that test? And how close was he? I mean, we saw on that debate stage how close they were. There are real questions about his health and safety as well right now. And I keep going back to the president's age. He is 74 years old. Joe Biden is 77. Melania Trump is 50 years old. That is the age range for people typically to get COVID and get sick. We are talking about a prime group of people who are in a very vulnerable position right now in terms of their age. I keep thinking back to some of the things that the president has said. It's like the flu. Majority of people survive, that he's very healthy. You can talk about some of the treatments that he's proposed without the scientific evidence to back it up, and everything all my colleagues have been saying about being on the White House grounds and seeing very few people, if any, wear masks. And hearing the president just as recently as that debate mock Joe Biden for wearing masks with frequency. To say that this just upends everything right now, 30 some odd days out from the election, is just a complete understatement. I don't think any of us have any idea what we are in store for right now. This is something we've not seen in American history.
And Cecilia, you mentioned it. The president said that the virus will just disappear. He said the end of the pandemic is in sight. During that debate, he essentially made it seem that the virus is under control. But going forward, I mean, there is a upcoming vice presidential debate as well. And you mentioned Joe Biden, but Mike Pence as well. We don't know exactly how close of a contact they've had recently. Do you see this changing? There was already questions about if the next two debates would happen between him and Joe Biden. But do you see this even affecting the vice presidential debate set for next week?
Well, I mean, it could. It depends, I think, on how sick or whether or not the president becomes symptomatic and is sick. And I think there will be questions about his health and whether he's able to govern. I mean, if, and I'm saying if here, hypothetically, he becomes very, very sick, Mike Pence is going to have to step in. And whether he can do a debate at that moment, perhaps he can. I just think we don't know. Again, this is completely uncharted waters. I would be shocked if the president is if we see an in-person debate of some sort between President Trump and Joe Biden. I mean, there's supposed to be another debate in 2 weeks. If you look at the calendar, the president should be under quarantine in that time. So there certainly won't be I can't imagine there would be another debate in 2 weeks for the president, let alone even after that. It just depends on how he feels and gets through that. Again, his age is a huge factor in this. And the questions for Mike Pence right now, I mean, certainly he will have also had to be tested if he hasn't already been tested at this point. So huge questions for him about whether there's a debate going forward for him as well.
And we are still waiting to hear from the Biden camp right now. Cecilia Vega there. Thank you so much. We appreciate it. Let's bring in Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. So you heard Cecilia there mention the president's age, 74 years old. We know this is a very contagious virus. We also know that Hope Hicks, who was in close proximity to the president, was already showing symptoms. What does this tell you right now, doctor?
Well, good morning. I mean, we know that this is a very contagious virus and that is spread through close contact, people who are generally within 6 feet, obviously unmasked is a risk factor. And it's not surprising when you look at transmissions. The biggest transmissions are people within households and obviously crowds that have been together indoors for longer periods of time. So, I think that this is something that is not necessarily surprising to say.
And a few months back, UK Prime Minister Boris Johnson went through his own struggles with coronavirus. He was at one point in the ICU. He struggled for 2 weeks, I believe, with the coronavirus, and he's much younger than President Trump. And so what are some of the issues that the president is facing now with the positive diagnosis?
Right. So, this is an unpredictable virus. So it's, but certainly we get more concerned with people who are older. and being in your 70s is definitely a risk factor for having more severe disease. With that said, most people, even when you're elderly, still, do well with this. But, it's important to have close monitoring, obviously making sure that you're isolated, staying, more than 6 feet away from other people, anyone who's, coming near you. Again, both people have to be masked because this is a period of time where both of them could be potentially contagious as well. So part of it is also limiting the spread to others even during this time period. So we say you need to be isolated, but it is important that, that's very, strict as far as, staying away from other people. And then as far as the symptoms that's concerning, the most important thing is your respiratory symptom, making sure that your oxygenation is okay. And remember, there's something that this virus can do that's called silent hypoxemia. That's a fancy word for saying patients' oxygen levels can be low even when patients are feeling okay. So monitoring that is very important. The other part of this virus that we've learned about is that it's multi-system, so it can hit things beyond the lungs, the blood vessels, the heart. So there's, obviously for anyone who's infected, especially if you have symptoms, you want to make sure that you're, measuring these different types of the heart, the lungs, and the kidneys, the liver. So, very close monitoring is critical.
And Dr. Ellerin, please stay with us for just a second. Before we bring in Dr. Jennifer Ashton, I want to reread this this letter from the president's doctor that the White House sent out. He said, "This evening I received confirmation that both President Trump and First Lady Melania Trump have tested positive for COVID-19. The president and First Lady are both well at this time, and they plan to remain at home within the White House during their convalescence. The White House medical team and I will maintain a vigilant watch, and I appreciate the support provided by some of our country's greatest medical professionals and institutions. Rest assured, I expect the president to continue carrying out his duties without disruption while recovering, and I will keep you updated on any future developments." Dr. Jennifer Ashton, you hear that coming from the White House doctor, and your thoughts?
Well, my first thoughts are, as a practicing physician, yes, this is the President of the United States and the leader of the so-called free world, but to that physician, he's also a patient. And so, he will be assessed obviously differently than if he were the average person, but in some ways, in terms of the way that physician is going to be taking care of him, it is no different. So the basics, as we just heard, he'll be monitored regularly for his vital signs, for fever, for signs of other complications. He'll be isolated, obviously, from any close contact, and he's going to be observed very, very carefully. We've known from the beginning of this pandemic that about 80% of cases can be managed in a home setting. Now, when your home happens to be the White House, obviously you have access to medical care that you or I don't have in our home. But, I think that obviously the medical staff of the White House will be working around the clock for the next 2 weeks for sure.
And Dr. Ashton, the president says that he gets tested regularly. There are a number of tests. What should we know about the type of tests that would have been available to him and what he might have taken?
Well, what's interesting about the surveillance testing, because remember, we have to distinguish between tests done for surveillance and tests done for diagnosis. Right now, the so-called PCR, generally the nasal swab or nasal pharyngeal swab, is the gold standard for diagnosis of acute infection. Surveillance testing now, we're seeing more and more of these rapid tests, often antigen tests, that generally can be thought of as having slightly lower accuracy accuracy. So when we do get a positive, it's confirmed generally with a PCR. But again, when we've heard the president say he's tested regularly, if not daily, that surveillance testing, this is an example of why that is critically important. And just for some historical perspective, just a few weeks ago, we heard Dr. Robert Redfield of the CDC say, if you've been exposed, quote, you need a test. And obviously, after Hope Hicks was diagnosed with COVID-19, testing the president was not going to be far in coming.
And Dr. Jed, I want to ask you, I want to go back to the president's doctor. In that letter, he used the phrase during their convalescence. Can you explain to our viewers what that means?
Well, convalescence means recovery. And the interesting thing about this virus, and as we learn more and more about it, is that this so-called long haulers syndrome, which is a post-viral syndrome that extends the period of a patient being symptomatic with these vague and mysterious symptoms, often lasting weeks or months, just reported again in peer-reviewed medical literature in JAMA. You know, that is thought to affect as many as 10% of confirmed COVID-19 cases. So when you hear the word convalescence in medicine, that implies the recovery period. We're just in the diagnosis period right now. So I don't think we can start talking about recovery. We can talk about observation, absolutely. But if we've learned one thing about SARS-CoV-2 in the last year, it's that it can act in mysterious and often unexpected ways. So I'm sure no chances will be taken, no assumptions will be made about whether we're in a so-called recovery or convalescence stage at this point.
And Dr. Ellerin, how long should the president isolate here? What are we talking about? Are we talking about weeks? I mean, we've heard that 14-day period for quarantine. But now that we've learned the president's tested positive for COVID-19, at a certain point, obviously they'll be monitoring for symptoms, fever. How long will he be contagious? Actually, Dr. Ashton, let me throw that question at you.
Yeah, so here's what we know about what we call the transmission dynamics. And again, we have to underscore 9 months ago, this virus was the new kid on the block, unknown. So when we say what we know, we always have to qualify it's at this time in terms of transmission dynamics, is that there can be a pre-symptomatic stage where people who have COVID-19 are infectious or contagious. That can be up to 48 hours before they start showing symptoms, if they start showing symptoms. Average incubation is 5.2 days. But again, up to 45% of known positive COVID-19 cases are asymptomatic. So we hope that the president falls in that category. You know, people generally are considered, according to the CDC recommendations, 10 days from the time of diagnosis or their first symptom is when they are recommended to isolate. So those are the general CDC recommendations at this time.
Dr. Jen, I want to ask you about something that our chief White House correspondent, Jonathan Karl, brought up. We understand the risk to the president's team, but he just had a debate with former Vice President Joe Biden in close quarters. There was a small crowd. Yes, they were 6 feet apart, but there was a lot of yelling. What is the risk to the former vice president and maybe anyone in that room, including the moderator, Chris Wallace?
That's such an important question, and unfortunately, we can't put a number, percentage risk answer on that right now. But ironically, the latest estimate was just published out of a big contact tracing report done in India that put the risk of contact spread or transmission, and again, these are thought to be close contacts, at anywhere from 4.7% to just over 10%. And as we know, we heard from Dr. Ellerin, we've heard the CDC say this from the beginning, prolonged close contact generally considered closer than 6 feet for more than 15 minutes of time. We don't yet know something very important about this virus, which is what's called the infectious dose. How much of the virus is required to actually infect someone and make them sick? And we don't know, again, the ventilation in that room, the movement, what they were doing during commercial breaks. There are a lot of variables that don't make that an easy question to answer.
Dr. Ashton, as we see states starting to lift restrictions, as we see the political fight over COVID-19, over wearing masks, as a medical professional, I'm curious about what does this say that the President of the United States, who has an incredible team of doctors at his disposal, has tested positive for COVID-19?
Well, I think it says the obvious. This virus does not discriminate. And just because you have great doctors and you live in the White House doesn't mean that the virus stops at the front door and then turns around. And I think, to take a macro view, this will be the diagnosis heard around the world in terms of, when someone this well known is affected with a medical or health crisis, there is an intrinsic opportunity here. And so whether or not we'll see the president completely switch gears and become kind of the walking PSA for mask wearing is unknown. But at this point, his physical condition, his medical condition, and the well-being of the president and those around him has to take first priority.
And Dr. Ashton, medical professionals, the CDC, for months now have been stressing the importance of wearing a mask in public, the benefits of wearing a mask. I want to play really quickly the most recent interaction between the president and former Vice President Joe Biden, in which he criticizes him for how often he wears a mask in public. Let's take a listen.
I don't wear masks like him. Every time you see him, he's got a mask. He could be speaking 200 feet away from it. He shows up with the biggest mask I've ever seen.
Can you, once again, just reiterate how important is it to wear masks to prevent the spread of the coronavirus, and what statements like that, the effects of statements like that coming from the President of the United States?
Well, first of all, to the first question, right now it is arguably one of the most important, if not the most important tool in our toolbox, in our arsenal fight against SARS-CoV-2. And we have data and evidence to support that in indoor settings, in outdoor settings. And of course, that's relatively new. By new, I mean this year. But distancing, mask wearing, being in well-ventilated spaces, minimizing exposure in crowded places, right now that's all we have. So those measures, those so-called NPIs, the non-pharmaceutical interventions, incredibly powerful in our battle against COVID-19. Your second question is really important, and I want to step into just the role of a practicing physician here and draw a really important analogy. When someone who smokes cigarettes is diagnosed with lung cancer or esophageal cancer or heart disease, the physician really shouldn't blame the patient for what's behind us. Right now, it's about staying in the present. It's about taking care of the patient and moving forward. And I would encourage people really to look medically at this. Of course, this is not just any other patient, but in medicine, I like to think of it as a judgment-free zone and not to blame a patient for a bad outcome. But I want to again emphasize at the same time that our behavior is very, very important, not just in our fight against COVID-19, but in the prevention of a lot of other conditions. So there's always something we can do. There's always a sense of empowerment that you can give an individual so that they don't feel helpless in terms of a medical or health risk.
Our thanks to Dr. Jennifer Ashton there. Dr. Ashton, we appreciate your expertise on this breaking news. Let's bring in our chief business correspondent, Rebecca Jarvis, right now. Rebecca, we saw your alert about the stocks. What else can you tell us?
So I can tell you that the tweet from the president saying that he tested positive for COVID-19 along with the First Lady triggered an immediate sell-off in stock futures. We saw it in the Dow and the S&P 500. And as it stands right now, the Dow is pointing down more than 500 points, meaning that if the market were to open at this time, the stock market would be down more than 500 points. That is about 2%. So in a percentage basis, it's not a gigantic amount, but there is this immediacy to the news itself. And keep in mind, we're about 6.5 hours away from the final jobs report, which the country will be getting a look at the country's economic picture prior to the election. This will be looking at the month of September. And so this news about the president's health also comes at a critical time for the country's economic health.
All right, Rebecca Jarvis, thank you so much. We will keep a watch on that. We'll keep checking in with you. We thank you.
And we are just weeks from the election. The president of the United States testing positive. Rebecca mentioned that already the stocks have been affected, but also we know that there's a lack of a stimulus package as well, and that can also have a toll on the economic impact too.
And we want to bring in Jonathan Karl one more time before we leave. Jonathan?
Yeah, I just want to point out something else that we learned that was gotten kind of lost in the shuffle here regarding Hope Hicks. Not only did she test positive, but we have also been told that she is symptomatic. She is sick. And I thought it was notable, just as Dr. Jen pointed out, the use of the word convalescence in the statement from the doctor. Also, the president himself, in his tweet announcing this, talking about a recovery process, raising, to me, a question of whether or not the president is not only in a situation where he has tested positive, but where he is also experiencing symptoms. That we don't know the answer to that, but we do know, again, the doctor using the word convalescence, the president talking about a recovery process, and we do know that his close advisor, Hope Hicks, is not only in a situation of being tested positive, but is also experiencing symptoms. Also, I'm really glad you played that clip from the debate of the president mocking Biden, criticizing Biden for wearing a mask so often in public. This has been a recurring theme, and I was out today at a Fairfax, Virginia early voting location where there were hundreds of people lining up to vote. I was amazed to see in this situation that everybody was wearing masks and socially distanced. And I want to say everybody except for literally two people. There were two people I saw out there who were not wearing masks, and they were two women who were manning the Republican tent outside the voting facility. Unfortunately, we have entered a phase where mask wearing is a political statement in some corners, and one would hope that this news will send a message out that this is a virus that doesn't know political differences, doesn't know political party.
Jonathan, thank you so much. We appreciate it. We will continue to monitor this breaking news, but for now, we will return you to your regular scheduled programming.
This has been a special report from ABC News.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.